The ClarIDHy study was available for patients with histologic confirmation of cholangiocarcinoma with, of course, mutated IDH1 by next generation sequencing, performance status with ECOG up to 1, prior lines of therapy minimum of 1, maximum of 2, that should have included gemcitabine or 5-fluorouracil, and of course measurable disease. Patients were randomized 2-to-1 fashion for the ivosidenib versus placebo. Patients on the placebo arm were allowed to cross over to the ivosidenib if they were to show evident progression of disease by radiology. The trial had as a primary endpoint the progression-free survival that improved in favor of the ivosidenib to 2.7 months versus 1.4 months for the placebo, and with the hazard ratio of 0.37 and the p-value less than 0.001. More importantly, and understandably that the progression-free survival will be reflective of when we take the measurements on the CAT scan, the continued separation of the curves was noted, with the 6-month progression-free survival for the ivosidenib was 32%, and the 12-month progression-free survival for the ivosidenib was 22%, while for the placebo, these two numbers were not as evaluable because there were no patients there. Importantly, the overall survival was for the ivosidenib arm 10.8 months. Understandably, because of the crossover nature of the study, a recalculation of the placebo overall survival was based on the RPSFT method and was 6 months only. And this was again statistically significant with a hazard ratio of 0.47 and the p-value less than 0.001.